Hello, welcome everyone. Good morning, good afternoon, good evening, wherever you are. Welcome to those joining us live, and also hello to those listening on afterwards through the recording. My name is Lina Badr, and I'm very pleased to welcome you today to the first episode of Setting Goals for the Decade Ahead, FIP's Development Goals Digital Program for 2021. I'd like to use this opportunity to very briefly tell you what I do and who I am, and also introduce my very esteemed colleague and co-moderator. I'm the FIP lead for Workforce Transformation and Development, and also the lead for FIP's Equity RX program. And I'm tuning in from Saudi Arabia. And my colleague Vibhuti Arya is joining us from the USA. Welcome, Vibhuti.
Welcome all. Thank you for got my coffee ready for the morning. I'm from here in Brooklyn in the United States, New York City, welcoming you all wherever you are, and hope you can join us for a very inspirational session today.
Thanks, Vibhuti. We'll be hearing from you again a few times. Vibhuti is FIP's global lead for FIP Development Goal 10, Equity and Equality, which we'll be talking a lot about today. We're moving on because there's quite a lot to go through. So very quick housekeeping. We'll get through this so we can hear from our panelists. Just to let you know, this webinar is being recorded and live streamed via Facebook. The recording will be available on our website, www.fip.org. Please ask questions using the question box provided, and please do interact and introduce yourself via the chat. We'd love to hear from you. And of course, you are welcome to provide any feedback about this digital event and our events in general by emailing webinars@fip.org. And if you aren't already, please consider joining us at FIP and becoming an individual member. And you can go to the website shown on the screen for more information. So, setting goals for the decade ahead. Our new series on the 21 goals, which have just launched in September 2020, which does seem like a while ago, but it isn't really. What is this series about? So it's a very comprehensive online event series. It provides coverage of the 21 goals over 21 events in 2021. So a lucky 3 number there, 21. The outcome of the 21 digital events is really to mobilize global pharmacy development and transformation through the development goals. We are using these events to describe the goals, engage with you on how we can implement them, what FIP does to support our members in them, and what more should we do by hearing from you about priorities. So by engaging you, our members, and our profession, we aim to provide description, direction, and context for each specific goal this year. We will present our tools, we will discuss how it's important to monitor and evaluate through data evidence, and also use these events to identify additional priorities across practice, science, workforce, and education. The series of 21 events begins today and runs from March all the way through December. And you'll see we're running about 2 events a month, and September is a busy one. And it usually is. We do run a number of events during World Pharmacy Week, which just precedes World Pharmacist Day. So you'll see a number of events there alongside our other digital events. So we'll ask you to, you can pre-register for all of these events for free by visiting events.fip.org. Please do so, and we look forward to having you in the future events as well. What are the outcomes from today? Today's event aims to describe the goals in general again, explain the components specifically of Development Goal 10, DG 10, Equity and Equality, as well as a breakdown of its 3 elements: workforce and education, science, and practice. We want to showcase to you what we have at FIP, our tools, evidence, resources that can support DG 10 implementation across the 3 elements. And we want to use this discussion today and interaction with you to identify some additional priorities across the 3 elements again. This is a special event because this is not only a series opener for the entire digital program, but we also feature 3 special launches from FIP. We will be launching today a new digital FIP Equity RX collection, Inequities Unmasked. That will form the latter part of our event. We will do an exclusive release of a global statement on vaccine equity from FIP that will launch today as well. And you'll have a first look at a new resourceful online site for FIP Equity RX, our program on equity and equality in pharmacy, but more on that shortly. A quick introduction of our speakers, many of whom are familiar to you, hopefully, if you've been through listening to a lot of our events and podcasts. Our CEO, Catherine Duggan, joins us from the UK. Claire Thompson, Chair of FIP Women in Science and Education, FIPWISE, and CEO of Agility Life Sciences from the UK as well. And Elizabeth Ridgway, a young pharmacist on the front line, as well as our coordinator for the FIP Equity RX program. We'll be hearing from them shortly, but first, a very quick debrief on the goals, just in case you missed this. Our 1FIP goals really bring together practice, science, workforce, and education. And it follows through our commitment that we can have no pharmaceutical care without the workforce. We can have no care without a strong scientific foundation over the next decade. The 21 goals build on the 13 pharmaceutical workforce development goals launched initially in 2016. We've built on those and through a consensus-based method expanded them to 21 goals that cover practice, science, and workforce and education. I'll just show you a very short video of the goals. And those were our goals. To find out more, please go to our FIP website to read about the goals, their elements, how they're developed, and everything you need. I think we're really keen to begin now the deep dive into development goal number 10. So we're just moving on. The equity and equality development goal really calls for clear strategies to address inequalities in the pharmaceutical workforce, widening access and equity of pharmaceutical care services and access, as well as equity in global capacity in pharmaceutical sciences development. So again, covering the three elements. Let's hear more from our CEO, Catherine Duggan, about this goal and how it links to FIP Equity RX program of work. Catherine, I'd like to invite you to join the floor, please.
Thanks so much, Lena. Hello, everybody. Welcome. Welcome to those of you who are joining us live, and welcome to those of you who are joining us at the recording. So, colleagues, I think none of us is in any doubt that during the past year, the issue of equity across all our countries and all our societies has been heightened as never before. It's super important for us at FIP and very relevant for us to start our 21 DGs in 2021 with DG number 10. The entire pandemic has offered us much time for reflection, and what we all need to do is to change as we move out of the pandemic. And COVID has highlighted to us issues of inequity in terms of ethnicity, age, demography, income levels, comorbidities. And it's really led us at FIP to widen the scope of the development goal from the important focus on gender equity and diversity to equity and equality. So you're all aware of the FIP Equity RX being the FIP Equity and Equality Programme. This programme supports the progress and implementation of the FIP Development Goal number 10, locally, regionally and globally, beyond gender and diversity balances. We want to extend to equity in access to care and all that this encompasses. We have sought to align everything we do with the United Nations Sustainable Development Goals in our FIP development goals, and aligning with the universal health coverage mantra of leave nobody behind. We wanted to operate under the motto, pharmacy, leaving no one behind. The Equity RX is a large programme encompassing many unique areas of work, all of which come together to support equity and equality for all. We have much to do, but we have started to make tracks. In 2018, many of us will remember Equity RX became the overarching label and unifying theme for the FIP initiatives on work on gender and diversity. And these initiatives focused on empowering women, both within and beyond the workforce, through promoting equity in our workforce, championing women in science and academia, and empowering women as informal caregivers. Never before has that been such an issue as in COVID, and never before have we seen inequities between men and women as informal caregivers, especially around the issues of caring and homeschooling. In 2019, through the FIP Equity RX collection, FIP announced the expansion of the scope of our work beyond gender and diversity balances and extending to equity and access of care and all that this encompasses. Next slide, please. So since the launch of the Development Goal 10, Equity and Equality in 2020, the scope expansion became an even stronger imperative to support the equitable access to healthcare for all individuals, regarding of social, demographic and health identifiers and their intersectionalities. Colleagues, we've seen such inequity between age, diseases, comorbidities, gender, literacy and access to education, mental and physical abilities, race and ethnicities, religious beliefs, sexual orientation, socio-economic status and class. In addition to growing our global partnerships, the FIP Equity RX deliver publications, tools, frameworks, digital events to support our members, to help to support transformation agendas nationally, to support our members to navigate through all these benefits and activities. And to do this in a very equitable and accessible way, we've developed a new site full of resources dedicated to FIP Equity and DG10. The site includes information about our areas of work, including workforce, education, practice and science, as Lena mentioned, our global partnerships, the events we're running, publications and much more. And we know that a site such as this will be so important as colleagues from different nations seek to download support tools and frameworks to mobilise their engagement locally. We're excited to launch this new site today. The site presents a comprehensive overview of our work and offers you opportunities to tell us where we should go next. And this collection highlights many of our 2020 activities and areas of focus. We invite you all to join us at equityrx.fip.org. Thanks so much, everybody, for your time today for this really important inaugural DG event. And now I'm going to hand back to Lena. Over to you, Lena.
Thanks very much, Catherine. Very exciting to see this site go live. And I really do hope our members and attendees find it really helpful, as it intends to be. And let us know if they have any feedback as well. That would be really helpful. Without further ado, we'll move on as well, continue our mission for today, which is to understand, describe, and dissect DG10. We'll look at the three elements, and we'll start with the workforce element. And for that, I'm inviting Vibhuti back on again to take us through the workforce element of DG10. Vibhuti, welcome on stage.
Thank you so much. So I think just to clarify too, I think that what was important and what struck me when Catherine was also talking about, the evolution of this development goal. In my work, and I think in a lot of our experiences as women, very specifically as well, we're not leaving our identities, in one sort of compartment at a time. There's a lot of identities that sort of intersect. And the importance and emphasis on this workforce development goal being on equity and equality sort of encompasses that, right? It's a little bit of a life cycle, if you will, that deals with not only just workforce and career development opportunities, but really ensuring that the life cycle of where we are in pharmacy and through healthcare actually maintains this commitment to equity and equality. It is to ensure that all of us, when we're, no matter where our spheres of influence lie in decision making, for example, that we are addressing, identifying gaps and addressing them in a sustainable way to actually think about equity actually being strategically implemented and integrated into our goals, not just what we sort of call as an afterthought. It is also to ensure that not only are we thinking about workforce education and practice, but also the science and research. And what I want to emphasize in the workforce development portion of this is that it's a wholesome look at it. It's not just individuals thinking about how they make decisions and how they participate in equity, but really about our policies and our procedures and the system, if you will, that actually provides the environment then for the individuals to survive and thrive. And all of this really should be applicable to capacity and leadership development, because we're really thinking about how to make a robust impact on a workforce that has equity woven into everything that we're doing. Next slide, please. So I'm very honored to be part of a team of global leads. So myself, my colleagues, Nadia Bukhari and Carleen McMaw, what we're really focused on is thinking about how we can start getting further in this conversation about equity as we've started out. So we have just put together this workforce reference guide for Development Goal 10. And really the idea here is to think about the ways in which we can help our community at large, and I mean globally, no matter where the decision-making lies in terms of government, in terms of pharmacy professional associations, continuing education and training, any other progression opportunities for careers, that we're really thinking about how we can identify clear strategies in addressing equity and diversity in the workforce and in our workspaces, frankly. And so this really is thinking about the way that we have thought through how we can identify tools and frameworks and activities so that other folks can actually look at this and say, okay, where am I in my organization? Where can I start? And how do I start working on this? Next slide, please. And what we're really doing is thinking about the ways in which we can guide some of this work on a strategic level. So we're going to be providing input into the FIP commitment to equity and equality that's going to be published later this year. We're continuing to sort of update this reference guide for this development goal, and we welcome any and all of your feedback. We certainly realize that what equity actually means, sometimes we use the same words, but they actually mean very different things in different settings. And so it's really important for us to understand how we can make something that's accessible and frankly being able to utilize in various parts of the world. And so if you have any questions or comments or some sort of ideas and things that you think we can help kind of put together to make it more relevant for your practice site, for your country, for your jurisdiction, please let us know as well. We're also working on developing a tool that actually supports Nation to help develop gender initiatives based on some of the existing work that has been led by our FIP members. And it's really important for us to also understand how women in the workforce are actually faring these days. Like, what are the concerns that they have? What are some of the opportunities, again, that we can help identify? And so we're thinking about also building on this Women in Workforce survey. We also want to develop some data indicators for this Development Goal 10, which we will discuss later today. And again, continuing to have sort of a robust collection for our FIP Equity RX collection that we want to continue to inform and advise based on some of the work that our members are doing across the world. Next slide, and I'll hand it over back to Lena. That was a quick and very brief overview of our development goal for workforce.
Thanks very much for that, Vibhuti. Really helpful. And it's really pertinent to say that since the launch of the 21 goals, we are ensuring that these projects, which have been running for a while, are FIP projects and include the newer practice and science elements. So that's part of our planning as well. But that was really helpful, Vibhuti. Thank you. And please feel free to ask any questions on the chat, and we'll have another chance during the panel discussion as well. Keep the questions coming and we'll make a record of them. We're moving on to the next element in equity and equality, which is the practice element. And for this, I'll invite again, Catherine, actually. Catherine, we've been prioritizing the expansion of these goals, and I think the practice elements have been the first step and the science elements followed through. Could you tell us a little bit more about why the practice element is important and what it really entails?
I certainly will try, Lena. Thanks so much. So the practice element of DG 10, a call for country to have clear strategies for equity and diversity in their service delivery, in service access and in service impact, so that all people have access to quality pharmaceutical care. Now, you'll all know there are a number of mechanisms to support the implementation of this goal. Many are drawn upon data and impact from other countries. And what we would like to do is to seek to support demonstration of strategies to address equity and diversity inequalities across all pharmaceutical workforce and career development opportunities. We would like to ensure full and effective participation and equal opportunities for leadership at all levels of decision-making in pharmaceutical environments, to avoid barriers for participation for all social categories. And we would like to see engagement and adoption of workforce development policies and enforceable legislation for the promotion of equity and equality. Policies and cultures for the empowerment of all without bias. And we would say this should be applicable to academic capacity and leadership development activities, but also applicable to all. Next slide, please. We seek to ensure the availability and use of service and workforce data and intelligence to understand and identify equity and equality issues and to develop evidence-based policies to address them. We seek to engage patients in identifying and prioritising needs and advocate for and on behalf of those underserviced or underutilising services. Consider acceptability of services by patients when delivering these care models. And recognising the importance of social accountability in delivering value-based healthcare. Next slide, please. So equity and equality in practice became an even stronger imperative because of the pandemic, as I mentioned before. We must not forget the global imperatives for equity and equality and inequities and inequalities unmasked by the pandemic that make it an even bigger imperative for us to act now. In May 2020, we issued a statement of principle on the impact of COVID pandemic on health equity and vulnerable patients and populations. FIP recognises that the impact of COVID-19 is closely linked to social determinants and will lead to increased vulnerability across communities, especially when there are underlying and existing problems. Addressing inequities and inequalities is more urgent now than ever, colleagues, as the world battles this deadly pandemic. And indeed, if we don't start to address them now, they will continue to grow once the pandemic has passed us by. Recognising and identifying the most vulnerable patients and populations to COVID-19 is critical and urgent, and it requires particular and specific protective strategies from governments and other stakeholders. And we know as never before that pharmacy plays an important role in addressing and alleviating these inequities and in serving vulnerable patients and populations during this pandemic. In particular, this statement focused on various vulnerable population groups, such as women and children who suffer from violence during the COVID-19 pandemic, such as marginalised, displaced and underserved communities, such as ethnic minorities, refugees and migrants, and people living in situations of informal economy. People living in countries with fragile and under-resourced health systems, with insufficient health workforce capacity, infrastructure or equipment. Patients with underlying conditions, including non-communicable diseases, which are in themselves a factor contributing to increase vulnerability to COVID-19, and of course, older adults. In this statement, FIP and pharmacists across the globe reaffirmed their commitment to serve patients and communities in all settings of practice, from community to hospital, clinical biology, and others. Not only now, but throughout the challenging times of the pandemic, and sought to promote equity in health protection and access to care across all people, especially the most vulnerable groups, leaving no one behind. We see issues emerging now around the access to services and care, and the role of pharmacy becoming even more critical and essential during these times. And one example we cannot ignore is vaccine equity. So all of us will have seen issues emerging now around access to services and care, and the role of our profession becoming even more critical in vaccine equity. The FIP Transforming Vaccination Globally and Regionally programme, delivered at the end of last year, was the first FIP digital transformation programme involving a three-part series of digital events, culminating in the 24th event, a global summit, and there the FIP commitment to action on improving vaccination coverage through pharmacies. The commitment highlights actions that are urgently needed to ensure equitable access to vaccines and vaccination services for people around the world. The commitment was during the first FIP Virtual Global Summit on transforming vaccination, and provided us with one of the key outcomes of our digital programme. FIP is also committed to supporting pharmacists and pharmacy workers with the most up-to-date intelligence on COVID-19 vaccines. And I would urge you all to visit our website for more information. But again, today, I'm super pleased that we can announce we're publishing a new statement of principle, which further supports the declaration and in particular calls for the acceleration of vaccine access for pharmacy teams on the front line. We believe that ensuring early access of the pharmacy workforce to safe and effective COVID-19 vaccines will contribute to accelerating access to vaccines for all, as well as the continuity of treatments and other essential services, continuity of medical products and medical devices provided by pharmacy teams. Our statement highlights the critical role that pharmacy teams can play in immunising populations and contributing to improving vaccination coverage, for example, through evidence-based counselling. It also reaffirms our commitment of our profession across the globe to widening access to pharmaceutical services, particularly vaccine-related services, to ensure vaccine equity for all. Again, leaving no one behind. So from me, thank you all. And now I'll hand over again to Lena.
Thank you very much, Catherine. A very important statement of principle launching today on perhaps one of the most critical equity issues of our times, vaccine equity. We're moving on to the final, but not least important element of FIP DG 10, the science element. And I'll actually invite Elizabeth to tell us more about the science element, followed by Claire Thompson, who will tell us more about how FIP is supporting delivery of this goal. Elizabeth, the floor is yours.
Thank you, Lena. So the science element of this goal calls for countries to have equity in the global capacity for pharmaceutical sciences training, research infrastructure, development and manufacturing capabilities, and evidence-based regulatory oversight. Some of the mechanisms included in this goal are to advocate for equitable career pathways to catalyze change across the pharmaceutical sciences workforce in academia, industry, and regulatory bodies, and then to monitor for the success of those strategies, which we've implemented across the spectrum of the pharmaceutical sciences to ensure sustained equity and diversity. And now back to you, Lena.
Thanks, Elizabeth. Elizabeth, we'll hear back from you again later. But on that first mechanism, advocating for equitable career pathways, I'll invite Claire Thompson, CEO of Agility Life Sciences, but also importantly, the chair of FIPWISE, to tell us how FIPWISE is really delivering on this mechanism. Claire, welcome on board.
Thank you very much, Lena, and congratulations on the launch of the new website. It looks fantastic. So I'm Claire Thompson. I have the honour and the privilege of being chair of FIP's Women in Science and Education, or FIPWISE initiative. So our primary objectives are to help achieve equity by building a solidarity network, empower women in pharmaceutical sciences and pharmacy education to achieve their full potential, and attract students and young women into these fields, so to fill and flow the pipeline. Next slide, please, Lena. So the FIPWISE team is small, but very, very powerful. And although I get to talk about what we do an awful lot, the drive for FIPWISE and all of the things that we deliver are really down to Nilhan and Yango. So I want to ensure that they get the praise that they deserve in what we have achieved in a very short space of time. Next slide, please, Ina. So we are just over a year old. We launched FIPWISE in February 2020, and essentially it was the initiative was started from a series of conversations at the Congress in Abu Dhabi in 2019, and we really wanted to figure out what's the need for this as an initiative, and how do we get this ball rolling. We have heard stories of inspiration, aspiration and exasperation over the past 18 months from various people who are leaders in the field, who have come up against some horrendous barriers within their career, and those who are aspiring to be great and want to have some guidance on how they can get through their career. So these pictures here showcase some of the times that we've been discussing some troubling items, and as you can see from the top left, where we've been sharing some fabulous stories as well. Next slide, please, Lena. So throughout our first year, well, as I said, we launched in February the 11th last year, which is the UN International Day of Women and Girls in Science. We've had a number of online events. We've had our Wise Words blog and video series. And we've also launched a mentorship program, which was oversubscribed, and we hope to continue to grow that. We also had our FIPWISE virtual Congress in partnership with the United Nations, and we're spreading FIPWISE around the world. So in our first year, we were really garnering what are the inspiring stories that we can tell. We were shining a light on those inspiring leaders and aspiring individuals, and also really trying to focus in on what our strategic objectives should be going forward. Next slide, Lena. We celebrated our first anniversary with a number of videos which really talked about where we've come from, what our strategic objectives are, and how we're going to address those going forward. And we've got a little aspiring scientist in the background, as you can see on the top left. Next one, please, Lena. We have a mantra within FIPWISE, is that we use our power, our platform and our privilege for good. So what we're trying to do is use these privileges to reform systems that no longer serve us well. And although we focus on women in this initiative, the practices, the programs and the platforms that we build will enable all of professionals to flourish and to thrive. So our 4 streams that we are working on as our strategic objectives. The first one is confidence in competence. The second one, enabling workplaces. So we're trying to identify and remove the barriers in workplace that prohibit women from being the best that they can. Supporting youth. So that is providing young scientists and students in education with a platform and a roadmap upon which to grow. And everything that we do underpins FIP Development Goal 10. I won't go into these too much. There is quite a lot of information on the website. Next one, please, Lena. And FIPWISE working group members, I'm a massive believer that success is not a solo sport. We have quite a number of women who have supported us from the very start, and the momentum of the movement is growing. So I just want to thank all of those men and women who have helped us so far and continue to help us to achieve our strategic objectives. We couldn't do this without you. Next one, please, Lena. And on International Women's Day, we launched our Fitwise and Fearless podcast series. So once a quarter, I will have the privilege to speak to some phenomenal women about their career to date, the barriers that they have come up against, how they've overcome those, what they've learned along the way, and would share with others that are on the same career trajectory, and when have they been fearless and what has happened as a result. And we had the wonderful Vibhuti Arya as our very first guest. Next one, please, Lena. If you would like to join us, either one of our working groups or join the initiative to help us to deliver on our goals, please get in touch. Get onto the website. You can contact us at education@fip.org, or you can scan the QR code here. Thank you very much.
So thank you so much. I think that I just probably am speaking for at least somebody in the audience when I say that this was kind of nice in terms of understanding not only the attention that equity is getting, but also just the amazing people and leaders behind this work. So I want to sort of open up a little bit into understanding, if I may pick your brains a little bit in terms of how we can further this work. And my first question for Elizabeth, if you don't mind, I know that Lena mentioned you're a younger practitioner, a pharmacist, but I want to say that, you know, as a newer practitioner, so to speak, as a person who's about to graduate and enter into the workforce, we have seen equity rise to the main stage of conversation in very deliberate ways around the world, not only specifically for gender, but also racial equity. And I think, Catherine, you mentioned so many different ways, right? And one of the things that I try to sort of impart an appreciation in the conversations I'm part of is that it's an intersection, right? It's a Venn diagram, and a very messy one at that, because we bring all parts of us to the conversation. And so it's not just about gender and age and race and ethnicity. It's all of that exists together. And sometimes those impact, many times negatively, many times positively. They can intersect and synergize, right? The way that we experience the world and the people in it. So as a person who's about to graduate and get into the workforce, as a white woman, as a person who's coming from a place of the United States, how are the ways in which in your own journey that you've learned that you can use your privilege to elevate this discussion of equity in the workplace? What are some ways in which you would like to see things happen and you utilize your own platform and power, so to speak, to elevate that conversation? Heavy question, but would love to hear your answer.
That is a very heavy question. So really thinking about kind of where I come from, I think that I am very lucky to have a voice, and a rather strong voice. And I think that just getting to use that voice to really promote equity and equality for every single patient that I get to work with in my career, and every single individual that I get to, have as a coworker, and to really offer them the same opportunities despite their age, their gender, any physical or mental disability, their ethnicity, and really socioeconomic status, to really give them the same kind of voice that I have, and to kind of share that voice with them and to give them the stage. And so for me, I think that's what I plan to do with my career, and I hope to continue that advancement.
Excellent. And I also love, I think that between Claire and Catherine, we also got an appreciation for understanding some of the ideas that this is not just a women's issue. This is not just an issue of any one sort of specific group. And Elizabeth, you also have mentioned this. I would say maybe I'll start with Claire. And you talked about FIPWise, which the idea about using the privilege to reform systems that no longer serve us. What are some of the ways in which you think we can get more people to do the work? I think that there's a lot of question around sort of this performative activism that has come up, right? People talking a lot about this, but there's sometimes it discourages people when they don't see action. And I think people are struggling with some of that action. What does that mean? How do I act on equity? And I see you as a person who, in the conversations we've had together, certainly there's an elevation of that voice. There's an amplification of that voice, and very, in a very raw form, right? That there's no sort of I think a lot of times people want to be polite or civil, but really we need to have these conversations that are very difficult, not just talking about wrapping it up in a pretty bow. So what are some of the ways in your advice would be to actually move into action with looking at equity in not only the workplace, right? Because we want this development goal to also think about the connection of all aspects. It's not just about workplace, it's not just about education, but about the practice and the research and the way every conversation happens from this. So what are some ways that you see people moving into action and your advice there?
Sure. So there's recognizing it to begin with. That's part of the issue of a lot of the barriers that we see are, well, it's always been like that, so people just take it as the norm. So we need to identify, and we need to shine a light on these things. And so I have the mantra of SALON, SALON, shine a light on nonsense where you see it. Little things, you can call it out, but for that, it does take bravery, and it takes you to have a supportive infrastructure behind you. Now, whether that's FIPWise or whether that's a few people within your faculty or a few people within your team, you do need to have that supportive structure around you that will back you up when you shine a light on that nonsense. However, the converse of that is we reward good behavior. I've got 2 dogs. The first thing you learn, do not reward bad behavior. So if you reward the bad behavior, and we're shining a light on excellence as well, then that helps to reinforce those good behaviors. And it sounds very idealistic. We do this with our children. We do it with our animals. We can do it within our careers as well. We shine a light on people that are excellent. We shine a light on practices that are excellent. And then we start to perpetuate that. So I think those are some of the things that I see are phenomenal ways to do it. But it does mean that you've got to be consistent with that. And a lot of the time you do have to be brave, and bravery breeds bravery, but it's difficult to do that the first time.
That's excellent. And I say that there are 3 W's with me present at any given day. I can be a worrier, I can be a warrior, and I can also withdraw. And those are my 3 W's that I go to. And sometimes all of them happen in the same day. Sometimes I go months in maybe one and not the other. But that this notion that we are all doing it alone is not good. And I love when we talked about this on the podcast as well, it's not a solo sport, right? Like it takes all of us to kind of get behind this. And Catherine, I know we've, touched on a lot of like as a leader, as a person who has a position of influence in this area as well. And I've heard you talk about, as a white woman, it's also important to amplify some of the other voices. And again, not just for gender and race, but really any other marginalized groups, right? Those of us who are part of any norm, which is, this sort of dominant narratives that is developed by the privileged group, for example, as an able-bodied individual, it is important for us to speak towards, folks who have, who are living with disabilities, for example, or physical or mental disabilities. And one of the ways that I've heard you talk about it so powerfully that I want to ask you as well is, a lot of times people will say, okay, yes, but we can do this, but how do you actually measure success? What are some of the metrics? And I know we're going to get into the data observatory in a little bit, but what are some of the ways that you as a CEO, especially, I'm sure you get called on to say, well, show me how you've actually done this. And it's really difficult sometimes to identify sort of specific metrics, if you will, right? In saying that, great, now we're an equitable world, and it might take generations to get there. But what are some ways in which you see your position of influence in furthering that conversation, but also like, what are some metrics that you would use as a measure of success? That's a really tough question, but you got this.
Boy, oh boy, Vibhuti, that is a toughie. I tell you what, I was very nervous as a CEO, as a woman of white privilege, coming from Northern Europe, taking on the mantra, even though I'm the first woman CEO of FIP. So that in one way was, an achievement, if you like. I was very nervous when I first got into this position of speaking out for others because I didn't want to get it wrong. But actually, I have to say the past year has given me some courage that speaking out for others doesn't mean you'll always get it right, but you're actually raising the platform for others. And there's that brilliant, I don't know if you've seen that little picture about equality versus equity, and you have the boxes reflecting the size of the person so everybody can see over the fence. So Vibhuti, I think it builds on some of the things that you and Claire have said. Courage takes a lot of effort and a lot of energy, and it can be very draining when you're on your own. But one of the measures of success is actually holding yourself to account. And I can't speak for you, Vibhuti, but as a woman, I can raise some of the issues that we share. And I think sometimes we need to look at what we share rather than what we don't. So the intersectionality piece is really, really important, but so is the common piece. Holding yourself to account is one of the most powerful metrics that you can have. And that is, what kind of values are you seeking to lead by, and what kind of values are you seeking others to show and shine? And that's number one for me, because I think in all of this work around equity and equality, if we have people who don't have a voice, who else is going to speak for them? We might not get every word right, we might not get every single sense right, but we will get something right, and that is about being heard. The second thing I think is by showing, it's kind of what Claire just said about, what is shining a light on excellence, but by showing what is good, and it doesn't have to be perfect, but by showing what is good, you can lead by example. And that's really important, because others may not know how to do things, or they might find it difficult. Not everybody is blessed to be quite as noisy as myself. So perhaps they might be shyer or less able to stand on a platform, for example. And then the third thing I think is by being in a position at FIP, the last year has shown me the team that we have, and I don't just mean the staff that we have at FIP are amazing, but also all the teams of volunteers. And where we were not on the front line, we had to demonstrate that we were on the front line by giving support. So everybody stepped up a little bit more. And by providing a platform for everyone, we've actually seen that people can come forward and start talking about difficult issues. And, I really think it's really important that we provide people with a platform to be able to be heard and to be able to speak, and also to be able to share their experiences, whether they have somebody in their family who has disabilities, or whether they have a community that they are serving that has got no proper, no proper services in infrastructures. There's a lot of inequities and inequalities that none of us can absolutely showcase. So we need to provide others with the platform to demonstrate that. I think Vibhuti, it's very difficult to measure. So I would say, and to come down to specific numbers and metrics, I think we will come on to that later in the presentation. But those three things, I think, are really important. And I think that enables us to do something. I don't know about you guys, but I felt that the last year, and it has been more than a year actually, has meant that we need to do something and then be seen to do something, albeit small steps. So they're my three take home. How would you measure it? Hold yourself to account, lead by example, and provide others with a platform.
Thank you. That was perfect. And I think part of the question really was to get at that point that it's not just easily measurable, and nor should we only strive to have certain metrics to quantify, right? What is such a huge topic in a journey. I think, Claire, you have something?
I do, yeah. So there's so much, and this has come out as an inequity essentially for women throughout the pandemic, and we've seen that from a healthcare perspective, but also from a social perspective, that we don't necessarily count what counts, and we must. So we need to look at the gaps of what is being counted and ensure that we are counting what needs to count. So what impact does it have on women? What impact does this have on people who are less able? What impact does this have on our other demographics? But it's not just the numbers, it's not just the quantitative stuff, it's the qualitative stuff as well. We're moving from a FIP-wise perspective away from the words and into the deeds. We need to start doing and not just talking, but we also need to ensure that what we are doing is having an impact. And that doesn't have to just be how many women are getting to senior levels, although that is an important metric and we must count that, but it does, because it does count. But is what we are doing actually having an impact on people's career and how they are feeling and how they are doing? So are they more confident in their competence? Are they able to share their voice? Are they able to share their concerns? And that's something we can't really metricize, but it is something that we need to be very, very mindful of as we progress. We need to give people an environment in which they can succeed. And we need to be aware of how we are doing that and what we do.
And that's excellent. And I think Catherine also mentioned the privilege is what you do with that position, right? Because we all, and it's, you know, it's a lot of it. It's a lot of different kinds of privilege that we all have. And it doesn't mean one or the other, but really, and it's, I think the other thing there is that, again, with this intersectionality, it's not the one thing that only defines you, right? Because we have to sort of stop agreeing to this binary. It's either this or that. And there's a story behind all of our faces, right? No matter what faces we may represent. It is important to understand and step into our own privileges where we have it, even though we may have a narrative that has been difficult and maybe not reflective of that current position of privilege that we hold. But it is important to see that we are also part of a bigger context and that we are part of the world. And in the world, those things, right, being a male or being whatever, it just, all of those are sort of part of that privilege system that exists, even though individually you and I may have had different narratives. And I think that that's really important because I think that people do struggle with that. And that comes in with this action, right, about, well, as an individual, I am XYZ, but as a system, the way systems see me and position me to be of a certain influence are maybe something different. And maybe I haven't really reflected on that. And maybe I need to have a journey with that. But we are all sort of on a spectrum of a journey wherever we are, right? Whether that means to learn things, but also unlearn so many things that perhaps may have been taught with a lens that was missing some perspectives, if you will. So I think that there was another comment about the confidence and competence, Claire, that you mentioned, the question of, it's kind of a bit of a, what we call the chicken and the egg, right? Do you have confidence first that then makes you competent, or do you have the competence that then feeds your confidence? I mean, it's a cycle. And then I'll go into the 3 W's as was mentioned as well.
Sure, it's a difficult balance. If your confidence outweighs your competence, then you're going to fail and you're going to be found out pretty quickly. But I think what a lot of us suffer from is actually being very confident, but being very competent, but not being able to say that out loud or put ourselves forward for things, or almost believe that we are capable of the next role, speaking on that panel, presenting at a global conference, for instance. So I think to have the firm foundation that the competence has to come first, but the confidence has got to go alongside it. Yeah, my aunt has a great saying that if you see someone without a smile, give them one of yours. I'm like that with confidence. If you don't have confidence, I'll certainly lend you some of mine.
And so that goes back to, I think, what you had mentioned with the solo sport, what I had talked about, and also what Catherine had said and what Elizabeth had said, right? It kind of combines this idea that it's not just me alone doing any of this. You know, certainly people have paved the way for us, but we also continue to intentionally do that for others. And there was a comment about expanding on the 3 W's. And I want to borrow a little bit from what each of you said in terms of also what I think is sort of allowing us all the grace to accept that we may not get it right all the time. Again, I think the right and wrong thing is something that we all need to sort of abandon a little bit because it comes from this binary thinking, right? That it has to be either this or that. You're either good or you're evil. Or if you agree, if you have a different opinion, that must mean that it's disagreeing with mine somehow. But I think what I'd like to hold and offer folks to hold is the complexity of just who we are, that your truth can exist, my truth can exist, the other's truth can exist, and it all can sort of coexist together. And so what I meant about the 3 W's was that sometimes, you know, I am sort of this warrior, right? I'm ready to tackle anything. I've got my collective next to me who are helping me and supporting me in everything that I do. And I'm ready to speak up and speak out. But there are days where I go into the warrior mode, where we are concerned about things, or we see things happening, and we need to sort of process things on our own as well in the context of what it means for all of us. And I think that the withdrawer, for me, what that means is sort of I go into self-preservation mode. There are some days where I can have the conversation, and I, you know, do this work for a living where I do racial justice conversations, but it is very difficult, and it can be challenging emotionally to hold space and hear things that, again, because people are at different parts of the journey. And so sometimes I just need to withdraw a little to kind of replenish my own self And I think that what all of you have really talked about is that we have individual accountability for doing the work ourselves, whatever that means, whether that means, again, reading a book, having a conversation, writing a policy, you know, whatever that means, and the scale of whatever that means in your own sphere of influence, but also the systems accountability, that we can hold each other accountable and work together so that a task such as sort of bringing equity into the workplace, bringing equity into our goals, bringing equity to science and research and practice doesn't seem so onerous that only one person has to do it all, that it's something that we all can share and sort of work together so that the celebration is that much sweeter, right? And the negative aspect perhaps, or the burden of it can be that much a little bit lighter, so that we're not just carrying it by ourselves. So I want to thank you for that, and any sort of last minute kind of pearl you want to drop on us. I think that we've drummed up some really great energy in the chat as well. So I will say Elizabeth, then Claire, then Catherine, a quick pearl that you feel you're ready to take this on, whatever that might be.
To you, Elizabeth.
Okay, when I think about just pearls related to equity and equality, I think about just ownership and accountability, and really using my voice every single day to do better for the future.
Excellent. Claire?
Yeah, sure. So I have a set of values that I've put together from my organization, and you know they range from being brave to being kind to being creative and inspiring. And I think Catherine's absolutely right. You've got to hold a mirror up to yourself and ensure that you are doing these things and that you are enabling and empowering others. I'm a big believer in it's a soccer term, it's a footballing term, in creating space for others to move into. So that's what I promise I will do.
And Catherine?
So Vibhuti, I think it's actually incumbent on me to bring us back to why we've broadened out the issue of equity and equality, and that is about the patients and the public that we serve as a profession. And using our own attributes and our own skill sets to make sure that we're doing our piece around that is also an equitable issue, because some of us may be better equipped than others. But if we can all support each other to do that for our patients and the public, and make sure that we're just seeing things through that filter, that when the COVID pandemic passes, as we hope it does, that we don't lose that insight that we've just gained, that things just aren't quite as equal as possible. Might I just also say, encouraging some of the grey thinking rather than this polarized narrative we seem to be all living in at the moment might be a really nice way to approach things, because I notice in all of our nations and our politics that you're either right or you're wrong. If you don't believe what I believe in, then you're wrong. And this is very, very troubling for all of us. So that's another equity thing. You can't get your voice across if you're trying to seek to understand the other person's view and you don't totally agree with it, or you don't see it totally for what it is. So that's another thing that I think we need to take from today, but all about patients and the public today.
Exactly. Yes. And putting them in the center, right? Putting them in the center of the things we do, so our own egos and agendas don't get in the way. Having a conversation rather than a debate, and holding that complexity in that gray area. That was beautiful. So thank you. Thank you so much. And I think we're ready to move on. I'll hand it over back to you, Lena.
Thank you, Vibhuti, and thanks for that really enriching discussion. I was certainly listening with very open ears. And as Catherine rightly says, it's going back to the patients, and Vibhuti, you agree, putting them back in the core. And it's about us at FIP. Our position is to help our members achieve equity and equality in pharmacy. And that's why we can't have goals without monitoring them and evaluating them, and progress is key. So for this next component of today, very brief few moments focusing on monitoring and evaluating DG10 and the goals in general. Really, really important to transforming and progressing. So for this, I'm going to invite my colleague at FIP, Chris John, lead for data and intelligence, to tell us what we're doing to support our members monitoring and evaluating the development goals. Chris, welcome.
Hi, Lena. Thank you. Hi, everybody. The FIP Global Pharmaceutical Observatory's mission centres around data, intelligence, advocacy and reporting. It is core to supporting the development goals. We know the importance of data, and for data to provide us with evidence, and for evidence to provide us with intelligence. So our first task, our mission, is to collate valid global data on workforce, education, practice and pharmaceutical science. As Claire mentioned earlier, this doesn't have to be quantitative data, it could be qualitative data as well, both are important. And we must undertake comprehensive analyses of collated data to provide accessible, high quality intelligence, and all this must be communicated innovatively to promote our member organisations' impact on health. And this communication will often be via the FIP Atlas, which is our visualization platform for displaying our intelligence across the globe. Finally, we will provide evidence-based strategic information reports and guidance on the application of pharmaceutical science, policies, practices, and services. Next slide, please. The key outputs and influences of the Global Pharmaceutical Observatories will be sharing and disseminating intelligence that informs policy formation and advocates for the profession. Country monitoring, reporting and information comparisons, and these could be benchmarking for equity and equality, for how many pharmacies we have, prescriptions, regulatory comparisons, vaccinations, service comparisons, whatever it is. Also research and analysis, evaluation of trends to support action planning, and one trend we have been evaluating for some years now is the gender balance within the profession. And to facilitate collaborative working and national and transnational networking. So we will be bringing nations and organisations together to deliver transformational projects. Evidence generation for capacity buildings are another output, and there's also potential for linkages with other observatories who are collating a lot of data and information, such as the World Health Organization's observatories and the Organization for Economic Cooperation and Development. So health system strengthening by tracking progress against the development goals is probably the key output and activity we'll be looking at today. Next slide, please. Just briefly let you know about current GPO actions and projects. We have a lot of work going on at the moment. We've got a big project called the METNA project, which is a multinational education and training needs assessment project. And it's the first global pilot of mapping education and workforce needs assessment using the FIP development goals as a framing device. So we're aiming for data retrieval in partnership with member organizations and using the project to develop a comparative assessment in terms of priorities across regional commonalities. And the project is supported through external unrestricted funds and an FIP commissioned workpiece. The main aim of the project is to address multinational needs-based education for the pharmaceutical workforce in a cohort of nations across the globe and evaluate policy gaps on a regular basis. As previously mentioned, we're also working on the Atlas, our online visualization platform to display important intelligence, and we'll be doing that for Development Goal 10. And linked to this is the development of a dedicated GPO website and database, which will serve as a repository for all the data we collate. We're advised on the strategic direction of all this work by the One FIP Data and Intelligence Commission, which meets regularly to discuss the big ticket items that provide assurance and guidance on achieving the GPO vision and mission. Finally, and the reason why we're here today, we have an important project that aims to produce indicators that will measure and monitor progress towards the development goals, which is where you all come in. So we have a short engagement activity, and we would be very pleased to have your help here. FIP needs your help and expertise engaging with a brief 5-minute activity to help us in developing indicators and metrics to measure and monitor progress with the implementation of Development Goal 10. So you can see there is a link on the screen, and if you click on that, you can visit this activity. It's just a question that that'll ask you about what your thoughts are on how we measure equity and equality. There's also a QRX code you can use as well. FIP is now seeking to develop indicators and country-level metrics to measure and monitor progress and performance of the implementation of the FIP development goals via the GPO. So during this event, we are seeking your support for this global indicators and metrics project by contributing to this brief activity. So if you can, click on that link or use the code, that would be fantastic. You'll also receive an email to complete the activity after the end of this event if you don't complete it during the event. So we look forward to your responses there, and I will now hand you back to Lena.
Thank you very much for that, Chris. We have shared the link to this engagement activity via the chat, and you'll have a chance to do it after the event, and we'll email you again, as Chris has said. Really, we would seek your support with this, and we will be doing this for every one of the 21 events. And you'll imagine that we'll be collecting all this data, which will help us at FIP in developing indicators. So your contribution here is really, really critical. And should you complete all 21 engagement activities, please let us know. I'm sure we'll find a way to appreciate you. We're moving on to the last part of our event, a few more minutes. So you'll remember we said we're launching 3 important pieces of work today: the site, which Catherine has introduced you to, the statement of principle on vaccine equity, which we've launched today and released. And last but not least, we are launching today the FIP Equity RX collection. And for this, I'll invite the CEO, Catherine, to tell us about the Equity Collection 2021, and we'll then run briefly through the content just to give you an idea of what's in there, but really give you space to explore it yourself. Catherine, could you tell us more about the Collection 2020?
I'd be honoured to. Thank you, Lena. Doesn't feel very equitable, the amount of words I've been able to speak today, but I'm absolutely delighted to announce the launch of the FIP Equity RX Collection 2020. The collection was entitled Inequities Unmasked and is the second FIP Equity RX collection. We launched the first one in 2019 with the theme Inclusion for All, Equity for All. And can you believe it, colleagues? We didn't even know about COVID-19 at that point. So how prescriptive that was, really. Since then, we also published the Transforming Vaccination Globally and Regionally collection, which captures the key outcomes of the digital programme I walked you through earlier on. And the FIP Pharmacy Education Journal also published a timely COVID-19 special collection, which I must say reports on the global responses in teaching, learning and delivery in pharmacy education during the pandemic. So both the FIP Equity RX collections share the same function as compilations of global evidence, policy initiatives, opinion pieces, seasonal features, generally stories as well as facts, focusing on selected FIP and pharmacy priority programmes of work. Of course, in this case, it's equity, but the two collections differ in 2 very distinct and important ways. The first edition was pre-COVID, as I mentioned, and it's hard now to look back and think that how much COVID really upended our lives. So around this time last year, a little bit earlier, the edition of the collection is an easily accessible digital version, this one, published on our new FIP Equity RX resource site, with an imperative that FIP Equity Collection focuses on the inequities unmasked by the pandemic. And really, by unmasking the inequities, we ourselves have unmasked and unveiled our new programmes of work. Some of those inequities are long-standing ones, but they have risen to the fore and in most cases worsened by the pandemic. Others, however, are an unfortunate direct consequence of COVID-19. Another milestone that differentiates the two collections was the launch of our FIP development goals in September 2020, which really anchored the collection that we've just published and launched today. So Lena, I'm going to hand to you to showcase some of the sections, some of the content, and really urge our attendees and those listening in afterwards to take a look.
Thank you very much, Catherine. We'll be sharing the link to the collection very shortly, but first we wanted to show you some snippets of what's in there. So on screen, just sharing basically the table of contents of this digital collection. So we have an editorial as usual, which really lays out some of what Catherine has just mentioned, but also a summary of the content. We have a digital leading editorial, which we'll actually play for you shortly. In the FIP view column, we explain a lot of what we've discussed with you today, essentially the evolution of goal number 10, how it built on workforce, the workforce goal, gender and diversity balances, and expanded into equity in all of its meanings in pharmacy. In sort of chapter or section 4, we have a spotlight on vaccine equity in pharmacy. Again, a summary of what we've done in 2020 through the Transforming Vaccination program, and also some of the outcomes. We have identified some mechanisms through that program to support DG10, specifically to help us with transforming vaccination through pharmacies. So we invite you to look at that as well. And in that, we link to the new vaccine equity statement we have launched earlier. In access to medicines in isolation, there's a story there of pharmacists supporting patients in lockdown that really sheds the light of how critical the pharmacy workforce is in ensuring access to medicines. And this links really nicely to the next episode in this program, which I'll promote to you shortly. The shadow pandemic, it really is about how pharmacies can help domestic violence victims. And the shadow pandemic is in reference to the rise in domestic violence during COVID. So really, really sobering and very, very important, and an extension of the services that pharmacy can really offer. Exposed really focuses on opinion pieces on safety and equity in the workplace, and we'll hear shortly via a small video from Carleen, our collection editor, on some of the ideas described there. The evidence room is our sort of permanent column that where we describe some data that is related to equity, and in this one we spotlight on a research abstract, which we'll describe in a moment. And similarly to the unfair rollout, which shows the secondary consequences of rollouts. While they intend to reach vaccine, to reach to the most vulnerable populations, sometimes the systems don't allow it to do so. FIP Equity RX in Action is really, really exciting because it follows through a story we started in the 2019 collection, where we summarized to you some initiatives that have been beginning in Pakistan through our member organization there, and it has really become a fruitful initiative that has led to a new gender equity hub. So we report on that evolution as well in this one. And last but not least, FIPWise in the pandemic, again, a spotlight on women in science and education and COVID, and Claire will comment on that. So we'll just touch on a couple of these and then let you have the rest of the day, hopefully, and maybe the rest of the week to explore through the sections at your own time. We'll actually play for you the leading editorial. We think it's really, it's very brief, very short, from Vibhuti. Hope you enjoy.
I'm Vibhuti Arya, one of the 3 global leads for the FIP Development Goal 10 on equity and equality. Health equity is often defined as the attainment of the highest level of health for all people, where no one is disadvantaged because of their social standing or any socially determined factor. The World Health Organization Commission on Social Determinants of Health has actually defined social determinants to be mostly responsible for health inequities. The way we define health inequities are really these unfair and avoidable differences in health status that we see both within and between countries. These health inequities mostly have structural roots that lie within all of our systems like education, taxation, labor, housing, urban planning, government regulation, and individuals have little or no personal control over these. Any public health emergency tends to magnify the inequities that already exist within daily lives of many communities across the world. Moving forward, we really need to think strategically on how to integrate equity into all of our operations and systems. Oftentimes, the people who are impacted the most by these inequities are really nowhere near the decision-making table when it comes to the policies and programs that actually directly impact them. The FIP Development Goal on Equity and Equality really focuses on the life cycle of our profession, from workforce education to science to practice, to ensure that every part of our pharmacy community is working towards an equitable future. Every member of our pharmacy community globally has the power and the agency to identify and understand how they, within their own spheres of influence, can impact change on equity. I hope you'll join us in this commitment to serve our students, our colleagues, and our patients. Together, we can make a difference.
Thank you for that, Vibhuti. Vibhuti, we have you online. Do you have any reflections to your reflections, which really, really excellently summarize the essence of this collection, but also equity and equality on pharmacy?
Sure. I think that, and from the conversation and the comments today too, I think what's most important to recognize is that there's it's a multi-pronged approach, and it's not going to be an easy fix, so to speak, but that it will be a journey, and it is up to all of us to do what we can to not only individually, be held accountable, as we've all sort of heard from some of the leaders here as well, but also in what we can do to reform the system. So I think that some of the stories in the equity collection, I think, are very powerful and frankly, just very deep in helping us all further the conversation to explore the various perspectives. We talk about sort of some of us are, as we're talking here today and have really the privilege to have this conversation and have reflection, there are many people who don't get to sit around and talk about this, right? That their fates are being determined as we're all having this conversation. And so I think that it's just a really sombering moment for all of us to remember that we are part of something bigger than ourselves, and that it is up to all of us to step into our power and really make a difference wherever we can. So I hope you'll join us in exploring the different parts of this collection. I think there's some really powerful stories there and examples, frankly, that you can use to deepen some of the dialogue in your own settings. Thank you.
Thank you so much for that, Vibhuti. Moving on, we have a short video from one of our collection editors and also another global lead on DG10 with Vibhuti in that team, and with Nadia, who also summarizes some of the issues that specifically are mentioned in the exposed section and the access to care. And let's hear from Carleen, actually.
The Equity and Equality Handbook shines a light on the inequities experienced by women in the pharmacy workforce and the impact of domestic and family violence on the health of women and children. It also focuses on the impact of COVID with regards to the respect and autonomy for individuals from the hostilities people express towards healthcare workers and support staff in pharmacies, to the disproportionate treatment of marginalised communities in government implementation of travel restrictions and quarantine lockdowns, as well as sharing some experiences and considerations on maternity and sexual harassment. The FIP hopes the Equity and Equality Handbook shares some perspectives and reflections on topical issues for you to consider.
Thanks to Carleen for her contributions, and you can see some of these articles yourself in the collection. Elizabeth has contributed to the evidence room and contributed a research summary, a research abstract on the effect of ethnic diversity on. Elizabeth, can I ask you to tell us a little bit more about this research abstract and the key outcomes and implications really coming out of it?
Absolutely. So this particular abstract was all about using my voice to shine light on the social inequities around me. And what we were able to show with this particular abstract is that when we controlled for factors like social distancing measures implemented in a state, ethnic diversity was associated with up to a 5-fold increase in COVID-19 related mortalities. There have been several subsequent studies that I've really gotten to be a part of subsequent to this, trying to determine the etiology of those things, or kind of this increased mortality, and just kind of giving a picture of where we are here in the United States.
Thank you for that, Elizabeth. And you can read through the abstract yourself as well. Elizabeth, you've contributed another article on the unfair rollout, so the unforeseen impact of vaccines.
Yes, I have. So this particular article is actually an opinion piece, and it really kind of details my experiences with the rollout of the COVID-19 vaccine in my home state of Missouri in the United States. And what I've in my experiences, and the sad reality of that experience is that I have not had the opportunity to really vaccinate some of the most vulnerable populations. And a lot of that has to do with access to technology and care. And it really just details kind of my struggles as a young practitioner, really thinking about how I can, ensure access or equitable access to care for these particular patients.
Thank you very much, Elizabeth. And I think last but not least for selected highlights today from the collection is Claire Thompson telling us more about women in science and education during COVID. So we've spoken about women in science and education in general and FIP-wide movement and initiative, but what about what women in science and education are facing during COVID, and how is FIP-wide supporting that agenda?
Thank you, Lena. So we had a specific event on this just as the pandemic had kicked off, and already we were finding that women in science and education were finding it hard to attract funding. There was a funding gap there, research funding and investment funding, and also find make the time to actually write publications, write funding proposals, because of the intensive burden of care which was really falling to women. Now, I'm a big believer that equity, like charity, begins at home, but as women were, for the most part, having to care for their children or for their families at home, that home life was really restricting what we could do in terms of our career. So we have certainly seen that already. So what we're trying to do is empower and engage with women at various stages of their careers to ensure that we can help to remove those barriers and those burdens, and really learn from what we have seen within the pandemic. But certainly it has helped us to build up a cohesive infrastructure and a tribe of people who are, going up and down that stress curve fairly rapidly. So we've been great at identifying where we are on the stress curve and responding to that as a collective.
Thank you, Claire. We don't want to give the full collection away, so that was just some selected highlights. However, we're pleased to announce that this is live now. You can visit the collection at equityrx.fip.org and you'll find the link to the collection there. Please let us know your thoughts. We'd love to hear from you. We are also at the moment envisioning what the next collection would be. So any ideas from you, our members, would be really helpful to support us in really refining what the next collection should focus on. And of course, from here on until the next collection, we'll be pushing out our activities, tools, events, publications, etc. So we won't leave
So I think we've lost Lena for a second. I'm going to jump in and just do a couple of words of reflection on the event that we've just had today. Thanks so much to our panelists, with Booty, Elizabeth, and to Claire. Thanks so much for your contributions. Thanks, Chris, for walking us through the work on indicators and for taking us through that activity. Colleagues, as I reflect on the first of our 21 in 21 events, watch out for the next 20. Equity and equality is a priority for our communities, for our patients and public, for our profession, and for ourselves as individuals. And we need to really shine a light on that, Claire. You've seen 3 launches today. You've heard about 3 launches today: the collection, the website, and our equity statement, equity in vaccines. And I think each of those has its merit, and what a great honour to be able to launch all 3 on the same day as we are launching this event as well. And I think it's super important that FIP in all its constituencies, science, practice, education, workforce development, all of our parts, that we all celebrate and really focus on the ways in which we can ensure equity and equality across all of our communities. I think I'm going to hand back to you, Vibhuti, and we'll see if Lena joins us so that she can share some of the Congratulations for such a great event on such a great day. Vibhuti.
Thank you. And I want to thank our panelists. I want to thank Elizabeth, Claire, and Catherine, and Christopher. You know, all of this work, I think the theme that we're seeing here is the collective and the community. None of us fight alone, none of us win alone. So it's really important for us, wherever you are in this world, whatever time zone, think about your own collective and your community where you can bring those voices together. I also want to highlight that if you have any suggestions, if you have ideas and things that you want us to consider, particularly within this workforce development goal, please share that with us. I think it's also really important to note that while some of these voices are in the Equity RX collection, there's so many other voices that we hope to amplify and bring up. There are a lot of hidden narratives that we would love to shine the light on, especially when it comes to excellence. We know that you all are doing amazing work. We know that you are all part of a movement, whether you may deliberately call it that or not, that we are all in this together. And we would love to hear your thoughts on the collection. We would love to hear and frankly gain some more submissions. We would love to hear some of your narratives and see how we can amplify that as well. So please come together as a collective. We are all better for it. We thank you so much for joining this event. We thank you for your questions and your comments, and we welcome continued thoughts. And we have Lena back.
Just in time to say goodbye, but I really wanted, sorry I lost connection, really wanted to promote our next episode in the series, which is about DG 18, Access to Medicines, Devices and Services, taking place on the 7th of April at 2 p.m. Central European Time. We look forward to having you in there. Please visit events.fip.org to pre-register for the 21 series program, but also to all of our other excellent events taking place. Thank you very much. Thanks again, Vibhuti and all of the panelists, and thanks for your attendance and for staying on. Bye for now.